I'm the program coordinator at Futurema Foundation, and I'm going to be discussing on the theme that gathers all of us here for the Kidney Health 1.0. So the reason why we've chosen Kidney Health 1.0 is due to the fact that we feel like just sitting here and discussing all of these challenges is not going to bring an end to the problem of kidney disease in Hadejia. And we felt like this is something that should be done every year or every now and then. So 1.0 meaning we can have 2.0, we can have 1.0, and depending on the time that we felt like we've addressed the problem, and then that's when we are going to stop with all of the effort that we are making towards that. And the theme is that of advancing kidney health through digital innovation. So for the presentation that I'm going to be giving today is basically going to be talking about how we can be able to leverage technology to enhance care for kidney disease, most especially chronic kidney disease, and how we can also be able to leverage technology to enhance health management. And for the presentation, I would like to make it very practical. I have heard a lot of the conversation that has been going around with regards to the respected panelists that have been trying to dissect the issues that has brought us to the current situation that we found ourselves here in Hadejia. And what we are proposing with the digital kidney wallet is a practical solution to that. So I'm going to describe a hypothetical scenario to all of us. So there's a place called Bai here in Hadejia, and I think that is one of the most popular places in Hadejia. And at Bai, there are two young ladies named Fatima and Aisha who are having a father that has been having problem with kidney, and then they've been looking on how they can be able to solve the problem. So for that, we look at the fact that this is something that can be solved with technology. And solving it with technology, we liaise with Professor Hadejia Abdu, for example, and then Dr. Suleiman to brainstorm and see how we can be able to bring a solution to this problem. And for that brainstorming session, we came up with a solution called the digital kidney wallet for us to see that we bring an end to this problem. And for the digital kidney wallet, we liaised with Aisha and Fatima, and then we contacted their dad, and he agreed to take part in the effort that we were making to see the end to this problem. And for that, we equipped their father with a watch that he's going to be wearing, a wearable device that he can be having on his hand, and then that is going to be having an AI interface, let's say an app that is going to be giving update on both ends, giving update to Hadejia Aliyu, for example, which is the father of Aisha and Fatima, and also updating Dr. Suleiman and Professor Hadejia Abdu with any of the fluctuation with regards to what is happening with his body, and then looking at the parameters that will determine the state of the kidney health of Hadejia Aliyu. And for that device, we calibrated it in such a way that it's going to be looking at majorly the blood glucose level, the blood pressure, and then the level of heavy metal, mostly lead and mercury in the blood. So anytime there is any fluctuation from the synchronization that has been done initially, from both ends, both the patient and the medical professionals are going to be able to have information with regards to that fluctuation. So with that, we look at the fact that we are trying to use the device to address the limitation that we are having with regards to management of kidney. A lot of us here are medical professionals or people that have had people that had kidney problems. So we know that there are standard laboratory investigation that should be done to every kidney patient. And for that, we found out that we would want to create something that is going to be assessing risk and something that is going to be managing a patient that is having this problem. And the management, we wanted to make it personalized in the sense that we would want to use that to collect important information, a data set that is going to help us to determine the exact cause of kidney problem in Hadejia apart from the management. So it's trying to solve a lot of things at once. And for that, we make it in such a way that we have a daily method for synchronization in a very simple way that Hadejia Aliyu has been put through so that he can be able to be able to utilize the technology that we are introducing to him. And we also make it in such a way that we are trying to use this as a way to prevent the new cases of kidney disease, and also to see how we can be able to prevent morbidity and mortality with regards to kidney problem. So with this solution, we notified Dr. Sulaiman and then Professor Hadejia Abdu that anytime there is fluctuation, a medical personnel is going to be alerted to either take care of Hadejia Aliyu at home, or for them to have him carried from his home to the hospital for an immediate care. And for that, it was noted by Aisha, one of the daughters of Hadejia Aliyu, that this is something that has helped their dad manage his problem that he has been having with his kidney. And because of that, she created a blog on social media trying to tell people that this is something that has helped her dad, and also to create awareness about the problem of chronic kidney disease in Hadejia. And after doing that, it created a ripple effect that a lot of people, including media houses, were talking about the problem of kidney around Hadejia. Local media station using the local medium of interaction, that's the local Hausa language, and people were able to have a lot of awareness with regards to the problem of kidney problem in Hadejia. And because of this solution that we've introduced, a lot of stakeholders, including government, multinational organization, and non-governmental organization, found out that this is something that should be scaled up so that it can be produced in a commercial quantity, so that people can be able to have access to it, and they can be able to use it at the comfort of their house. And for that, we were able to see that we've improved on a lot of indices with regards to the kidney problem in Hadejia. And we were able to conclude from all of these things that has happened with Hadejia Aliyu, Aisha, and the effort that she has made on creating blog, that it has stabilized the rate of issues, crises that her father used to have because of the kidney problem, and it has also helped in reducing the risk of other people coming down with kidney problem. It has created a lot of publicity with regards to the public knowing that this is how they can prevent themselves from coming down with kidney problem, and it has also helped in reducing the burden of morbidity and mortality with regards to the kidney disease. And then was all of this scenario, we found out that this is something that should be adopted in any place that is having kidney problem like Hadejia. So this is what we are trying to do with the digital kidney wallet, and this is what we think can be able to solve the problem with regards to the gap in the provision of data, accessing the actual cause of kidney problem in Hadejia, and seeing that this is an effort that can be used to be able to address the problem of health management with regards to other conditions, not just the kidney problem in Hadejia, using AI and other modern technology. Thank you very much.